So this lesson is going to be on role socialization, and this is a unique topic that really has more to do with how you can go about learning and preparing for change uh, from one organization to the next. For most of you, this will be most important during the transition from your education to your first job. So I want to talk a little bit about some special issues associated with that so you have some ideas about what's going on during that and hopefully give you some strategies. So let's go ahead and take a look at this from chapter 7. So what professional socialization is, basically, this is just a fancy way of discussing the onboarding process and the change in mental models that occurs as you transition into a new organization and even into a new field. So you can look at professional socialization from an organizational standpoint or from a career standpoint. And when you look at it from a career standpoint, it gets broken down into the anticipatory socialization and the organizational socialization. So right now, you're in the anticipatory socialization. You've been recruited, you have some idea that this is what you want to do. And so you've begun your formal academic preparation. Then you transition into actually doing the job. And so in athletic training, we often call this role transition here as transition to practice. And so we spend a lot of time in our program, as well as in your education, trying to create as seamless of a role transition as possible. So hopefully by doing your immersion experiences, you are seeing what it really would be like for you to be the athletic trainer in charge, not just a student anymore. But that's a very difficult thing to happen. Even the best case scenario where you get a great immersion experience, there's always going to be somebody over you that you're working with and that safety net. Once you graduate and you start working on your own, you're ultimately in charge. And so things like increasing in hours, increasing in patients that you have to see, or just being ultimately responsible will create different changes. And so understanding that and knowing that going in can make it an easier process. And so there are a variety of different things that occur during that organizational socialization component when you first come into a new job. We can divide these into more and less structured experiences, and each one of these have their own unique definitions, everything from going through maybe like a new staff academy that would be a collective structured thing, to just informal aspects where you just hang out with your coworkers and try to see how things go down in that situation. And so each one of these are different components, and they all have their advantages and disadvantages, but understanding that during specifically that first year, you're going to be going through all of these socialization experiences helps you understand that everything that occurs during that first year is part of you understanding what these changes might mean. And so from a just benefits and costs associated with that, the more structured the socialization aspect is, the better and more clear the role is for each new person. So if you go through a very structured organizational socialization where they teach you specifically how they want you to document and specifically how they use treatment times and what sort of best practices they have, obviously that will make it much easier for you to understand specifically your role and how to go about doing your role. But that comes at the cost of creativity and you being able to put your own stamp on the situation. And so less structured organizational socialization, which are much more common in athletic training, where basically they rely on the fact that you are a professional and you know how to do the job and you know how you want to do the job. That allows you to be much more creative and individualistic with how you go about treating your patients and performing your duties. But the major drawback with that will be the possibility of role ambiguity, stress, and conflict. And so, since those are more common, let's talk about some of that and how that goes with that. And so, one of the main components is when perceptions don't match reality. That's when socialization has failed. And so there are a few different components with that, and we'll talk about each one of those individually here. The first one is reality shock. And reality shock is when the job responsibilities differ greatly from the educational or employment experiences of a previous organization. And so really this is a disconnect between what the new employee thought was going to be the case and the reality of that. And that's where the term reality shock comes from. And so there are different ways you can see that are there to reduce this, but when we talk about how to improve socialization at the end of this lesson, we'll talk a lot about this is going to need to be clear communication on the front end. Hopefully during your educational experiences, you are getting some behind the scenes look so you understand what the job really looks like opposed to just your own perceptions of that. And so hopefully reality shock is not as big as we try to focus on transition to practice in your educational aspect, but that's only going to be as good as your ability to understand what is expected of you going forward. For me, as an example, I took my first job and I didn't realize one of my duties was to cover the wrestling team until my first week there. And I didn't actually find out that I was responsible for the golf teams until my second year. So for a whole year, I had no idea that I was supposed to be covering the golf teams, mainly because there wasn't much for me to do except for the paperwork, and somebody had already done that for me that first year. And so it wasn't until my second year where that individual came and said, hey, you need to do this. This is your job, that I actually figured it out. And so that was just a reality shock for me from the standpoint that I did not understand what my job duties were going forward. So that was a lack of socialization both on my part and on the organization's part. Just as common, or probably more common long term, is this idea of role-related problems and role strain and role stress. Now in athletic training, oftentimes there is dual duties, whether it is covering more than one team, having increased responsibilities in teaching, or just multiple administrative duties. It's not ever as simple as just one duty in athletic training. You have multiple duties, and those duties can sometimes create strain or stress on the individual. And so role strain is when you have this emotional response to that while attempting to perform multiple duties. And role stress can be specifically when these are more vague. And so some of these components that you see there are like role conflict, role ambiguity, role incompetence, role incongruity, and role overload. So each of those have their own specific definitions as well, whereas role conflict is much more where your two components are in conflict. You may have to be in more than one place at the same time. Like for me, I had indoor track and wrestling at the same time, and they practiced at the same time. So to cover both of those practices was actually impossible. And so that's role conflict that obviously causes stress on the individual to try to manage both of those teams while being unable to be at practice, and each team wanting you at practice. Role ambiguity is the idea that you don't know what's expected of you. And so that can be either because you don't know what they expect you to do, or you're not completely sure what all is your responsibility and what is somebody else's, Role incompetence now is when you don't have the skills that's needed to be done. This could either be because you're a new grad and you're still learning, um, and so you're not as well prepared as some of the other clinicians, and so that becomes stressful for you as you're trying to get up to speed. Or it can be something more long term where individuals take on additional duties, whether it's teams, athletes, or administrative duties that they're not confident in their ability to do. And so they don't have the necessary education or background to do that well, which can be stressful. And then role incongruity is when you have multiple things that don't really work out together, where you have different components that you have to do, and they're just not aligning together. And that could be from having multiple bosses, multiple coaches, all sorts of different things, fairly similar to role conflict. And then role overload is actually often done both by administration and by the athletic trainer themselves. And this is where the individual takes on specifically more duties than they're able to perform. Either that's because they're assigned more teams and more patient load than they can actually perform, or they agree to do additional aspects. We've talked about coverage versus care previously, and this idea that if you're hired to take care of, hundreds of athletes, the ability to provide individual care is not possible. And so trying to do individualized rehabs with each of these individuals just adds to long hours and this role strain where you feel like you're being overworked. And the reality is the administration has hired you more in this idea of role coverage, where you're just there for emergency situations, whereas you're trying to provide care. And so this is where it becomes difficult, and you have to be honest with yourself as well as with your administration on what can and cannot be done. Because if role strain is allowed to continue for too long, what ends up happening is, in order to try to deal with the role strain, athletic trainers at their heart are hardworking individuals, and so they try to just work more and more and more, and that leads to problems with this work-life balance or work-life conflict, where you have this situation where you spend all of your time at work, thereby decreasing your ability to recharge and reload for more work, right? So it's work-life balance, and work-life conflict is just as much about your ability to be successful at work as it is to be successful at home. And in research, we've seen that number of hours as well as travel are big components of work-life conflict. But at the same note, it's this perceived lack of control. This idea that, if you as the athletic trainer do not stand up for yourself as a professional, it's very easy for you to be at the whims of changes for coaches, different aspects like that, where you do not have any control over your day. You're just sitting there waiting for athletes to come in or for practices to be changed. And so that's part of that aspect that we talked about as far as the healthcare provider versus the team-oriented approach. And so really what ends up happening in the take-home message with this is, role strain is when the organizational expectations cause some sort of problem, and you see the problems listed there, and that leads to job dissatisfaction and potentially burnout, which can be very problematic for your career. So it's one of those aspects that you need to start off and understand these ideas of socialization in order to prevent burnout and job dissatisfaction, which will lead you to having to start over professionally. The last thing to kind of talk about as far as a structural aspect of socialization and change is how the idea of different organizational structures can lead to differences in socialization. And so more bureaucratic structures, where it's more top down, there's a very organized hierarchy there, tend to improve in the formal aspects of socialization, which has been associated with a decrease in role strain. But at that same note, athletic training as a whole is much more individual and professional in nature, where you don't need a whole bunch of supervision with that. You work in a semi-autonomous way. And so, more flat organizations have been associated with better overall care and less role strain there, but the socialization process isn't as good. So it really is this happy medium of you as a professional and your organization trying to find the appropriate balance between formal and informal socialization so that the individual has both the autonomy they need to be successful while also have the background knowledge in order to understand the organization. And so lastly, to bring this together as far as what I would like you to understand, what you can really do, the most important thing is understanding that when you start applying for jobs, it is very important that you do your homework on the organization as well, and you interview the organization at the same time that they're interviewing you. You need to make sure that they're a good fit for you as well. Otherwise, you're not going to be successful. And you need to have a successful launch in your professional career so that way you're not constantly moving around. Because compared to school, where there's a given endpoint, once you start working, there is no predetermined endpoint. You don't graduate from your first job after a certain number of years and are forced to move on. Hopefully, you either stay there for a long time or you get to decide when you move on. But the last thing you want is for it to be a bad fit and for them to force you to move on with that. And so you need to make sure that your treatment philosophy, your understanding of the job, your values and expectations align with that of the organization. After that, really, it's very much understanding what sort of ways you can go about decreasing role strain for yourself. Whether that is, connecting with other colleagues at similar work settings, both within your organization, or if you're at a place where you may be more independent with that. The NATA has young professional groups where you can meet and talk with other young professionals about what's going on in their worlds, as well as get, more established mentors that might work in your work setting as well. And then understanding really that this is an interactive process where you have to be involved in, understanding and growing as a professional, and you need to be involved in understanding that just because there's not a structure telling you exactly what to do doesn't mean that you can't figure out what you need. The more structure you have, like I said, the less professional autonomy you're going to have, and the more you'll feel like a student, which can cause stress as well. So it's realizing that sometimes if you don't know what's going on, it's up to you to not figure it out, but learn and try to adapt and come up with better ways of doing stuff, and then ask about that going forward. So wrapping all of that up, what I hope you get out of this is the idea that during your first job, you're going to be going through a big change, specifically with that first job, moving from a student to a professional. And so understanding that that is going to occur gives you some time now to start asking your preceptors and your mentors about how they went about making that change, while at the same time observing them and seeing what the difference is between you and them, and starting to understand that here in a year or so, you will be them working with your teams in that semi-independent role, and starting to think about how you might do that. Create your own philosophies, your own thoughts, opposed to just doing what you're told as a student. And so hopefully that gives you a few different things to understand. And as always, if you have any questions or anything, let me know. Thanks.